Heroin, it has become a serious issue in America and right here in Spokane. In fact, tomorrow, 2020 will air an hour-long report that gives viewers an unvarnished look at several families struggling with heroin addiction and the lack of help. So what's the reason behind the sudden increase in addiction across all age groups? ABC News Chief Health and Medical Editor Dr. Richard Besser talked with Good Morning Northwest's Derek Dice this morning.
Big connection that we're seeing is opioid pain relievers. The vast majority of people who are addicted to heroin started with pain pills and then moved over because the cost of pain pills is so high.
And Spokane County is not immune to the problem. The Spokane Regional Health District says in the first 6 months of last year, there were 154 emergency responses for an opioid overdose. The Spokane Fire Department says it responded to up to 3 narcotic-related medical calls per day over the last year. KXLY4's Grace Ditzler working for you now with what first responders and drug rehab centers in our area are seeing. Grace?
Nadine, the Spokane Fire Department says in the last few weeks they've responded to double the number of serious overdoses from heroin and other narcotics. And a local drug and alcohol rehab center that caters to young women says 22% of the girls that are at their facility are battling a heroin addiction.
It's a problem that doesn't seem to be going anywhere.
Our paramedics are up against truly an epidemic in the city of Spokane.
Just yesterday, paramedics responded to what appeared to be 3 lethal overdoses. The medical examiner has yet to release the official causes of death, but Assistant Fire Chief Brian Schaefer says the scenes were consistent with what they normally see when they respond to narcotic overdoses.
A couple times a day, you'll hear us responding to a cardiac arrest, and there's a high likelihood it's a narcotic overdose.
Olivia Caillou knows firsthand what it's like to be on the other side of that 911 call.
I know my mom's out there dying slowly because of heroin. Like, she's overdosed in front of me 3 times.
Olivia is recovering from her own heroin and drug addiction at Daybreak Youth Services.
And one day I asked my mom to give me a hit of crack, and she did. And then just from then on, I thought everything was okay to do.
Heroin is easily accessible all over Washington state. Olivia is from LaConner.
Honestly, to me, it's just like going to the store to buy something. Like, you can just, it's everywhere, anywhere. Like, I could just walk outside of my house and it will be there.
She says after she leaves Daybreak, she'll stay in Spokane.
I've grown up so much since I've been here. Like, my attitude's changed, and I really want to be sober this time.
And to help people stay sober, Schaefer says there needs to be more detox and rehab programs like Daybreak available, because first responders are doing all they can.
Because right now, it's a Band-Aid. It's putting a Band-Aid on a huge evisceration, and we just can't keep up with it. We're truly bleeding out.
The Spokane Regional Health District says while it seems there has been an uptick in heroin use in our community, they haven't seen an increase in their methadone and needle exchange programs. And the most recent data from the health district from 2015 says there's actually been a decrease in heroin-related deaths, but it'll be interesting to see what the new numbers will say when they come out. Reporting live in Spokane tonight, Grace Ditzler, KXLY4 News.